So Susan from YouTube wants to know, should you stop taking your daily probiotic when treating parasites? What are the best supplements to take to help with a parasite cleanse and support the digestion and the microbiome? So I love this question. Most people have parasites. We don't like to think about that, but we do. So it's about kind of managing the whole microbiome and your the load of parasites. And of course, there's different types of parasites. Some are a lot more pathogenic, and when we do testing, we can see which ones are more pathogenic, and those are the ones that you really want to address. But and we have lots of different products to address parasites. So do you want to start talking about those, and then we can talk about binders?
Yeah, for sure. And so when we find that parasites are an issue through our testing, I know Melissa works with people all around the world. Our whole health coaching team does. And so there are certain symptoms that people will see or that our coaches may see associated with parasites. One of the common ones is, for example, a lot of itchiness. That can be a histamine issue, of course, but that can also be related to parasites. Being woken up around in that time period between 1 and 3 a.m. is very common. And particularly around the full moon, that can be really common with parasites. And of course, we'll look at different labs as well, like a stool analysis to try to identify parasites, or, you could see some markers on blood work, like high eosinophils, which is a white blood cell marker that is often associated with parasites. And so there's a whole kind of pattern that we'll look at. And if we identify that parasites are an issue, one of the big things we'll do is a full moon parasite cleanse. And so we know that parasites, they're more active when they have more serotonin. When our body has more serotonin in the system, parasites become more active, and melatonin is a little bit more inhibitory. And so around the full moon, we've got more light in the sky, and that tends to activate the parasites more. And so they're more active, and therefore it's a great time to use targeted supplementation to help reduce the overall parasite load. And like Melissa said, all of us have some level of parasites. They need to be in a certain balanced threshold. When the parasite load gets too high, we can have a lot of unwanted symptoms. They can obviously rob us of key nutrients, and they produce a lot of toxins. And those toxins drive up inflammation in our body. So to get the parasite load under control, we'll use different herbal supplements and binders. Particularly, we'll pulse them in around the full moon, usually like starting like a week before, going to a week after. Okay. And for some cases, we might do, 2 months on parasite herbs kind of straight through and just go more intense during the full moon. It just depends on the individual, the overall parasite load. And so some of the things that we're using are some great herbs from a company we use, Cellcore. So they've got Mimosa pudica, which is a kind of a really sticky, gelatinous herb that is really good for kind of grabbing and holding parasites, almost like a binder for parasites. And we'll talk more about binders as we go on. And then there's other great herbs. Clove is a really, really good one when it comes to getting rid of parasites. Black walnut, wormwood, sweet wormwood is another good one. Vidanya, which is a Ayurvedic herb, that's also really, really good. There's a whole number of them. Berberine can be helpful, garlic. So a whole number of them. And we use a protocol, particularly with 2, sometimes 3 different supplements. And then also we use a binder, and binders are compounds that almost act like a sponge, where they kind of grab, but instead of like releasing, they grab and hold particularly toxins that are produced by the parasites. So we're talking about microscopic toxins. We're not talking about the actual organisms themselves, although in some cases they may bind, like charcoal may bind to some of the organisms. The kind of binders we're going to use here are more specific for the endotoxins that are produced by bacteria dying, as well as what the parasites are releasing, candida, different fungus, what they're going to release in our system. We call that endotoxins, and they're going to bind to that and help pull that out of our system. So we use a product called biotoxin binder that happens to be really, really good for these kind of endotoxins, grabbing those, pulling those out of the system. So that way we don't get unwanted reactions. A lot of times when people have done anti-parasitic herbs or antimicrobial herbs, they have unwanted reactions, right? More skin inflammation. They feel lightheaded, dizzy, headaches, really a lot of fatigue. And that can be because of these toxins. It's often the case that are released out into the bloodstream and they start to poison the mitochondria in our body. And so that's why we want to take the binder to make sure that doesn't happen. The binder is able to grab those things, pull them out of the system so we don't get those unwanted reactions while we're doing this sort of cleanse.
Yes, definitely. And as far as her question on probiotics, I do recommend probiotics with any type of parasite protocol because these herbs, while they can also affect the gut microbiome. So they're not as destructive as an antibiotic would be, but they do affect the microbiome and the good bacteria. So we want to support the good bacteria while we're doing any type of antimicrobial protocol. And I also want to stress the importance of, she mentions digestion. So whenever you're doing any type of parasite protocol or antimicrobial protocol, it's critical that you're having really good bowel movements. So we want to make sure we're supporting digestion and elimination during that process. And, digestion is really critical for keeping parasites at bay because the stomach acid that our bodies naturally produce helps to kill parasites. So that's a way that our bodies naturally keep parasites at bay. And a lot of people aren't producing enough stomach acid, especially as we age, we produce less. Or if we have any kind of GI issues or gut issues that can cause lower stomach acid. And there's a marker we can look at called elastase that tells us and a sufficiency of enzyme and HCl production, and blood testing too can indicate that. But so you definitely also want to consider, supporting digestion with digestive enzymes. We've got a couple of different options there. One has stomach acid if you do have low stomach acid. One does not, and just really supports nutrient absorption, breaking down the food so that you're absorbing the nutrients in food. So all of that is going to support, whenever you're addressing anything with the gut, doing all of these supportive things and making sure your diet's really good because you want to be feeding the good bacteria with prebiotic foods, lots of fiber, all of that's going to support digestion and elimination. So, there's a lot to it, which is why it's great to work with someone with experience in guiding people through protocols when you're going to do anything like this. So.
Yeah, super key. And you mentioned constipation being an issue. I mean, you really don't even want to start a parasite cleanse until you get things moving, right? And so just kind of getting your bowels moving. In fact, a big part of what we try to do is open up all the drainage pathways, get the lymphatics moving better, kidneys functioning better, liver functioning better, kind of as a prerequisite before you start doing any sort of intense parasite cleanse or any sort of kind of microbiome makeover. You really want to support all those drainage pathways. That way you're eliminating toxins. Otherwise, I mean, you could throw binders in there, but everything's just kind of sitting there, putrefying, fermenting, and it's going to drive up more inflammation in the system.